what we wanted to deliver in Greater Manchester was a seamless end-to-end solution that would aim to deliver any item of clinical correspondence, whether that's a discharge, an A&E discharge, an outpatient letter, to any practice in Greater Manchester within a 24-hour period. The scope is 10 acute hospital providers, 4 mental health and community trusts, and ascending organisations, and 503 GP practices who are receiving end users. The business case that we established and developed getting on for 3-4 years ago now anticipated that we would send 4.7 million letters through this solution on an annual basis. So if you work out what the cost of that is, the cost of a post, this was based on, old figures, 65 pence. I'm sure it's probably near enough 80, 90 pence to send a letter these days. But the savings there speak for themselves, for certainly from the provider side of things. If you do the maths, it works out at quite an easily achievable significant amount of savings of 3 million plus across those 14 organisations. We're focusing on the 10 main GM acute providers in phase 1. And then phase 2 makes up the 4 additional providers that came on board, which is 3 mental health and 1 community trust. Phase 3, just a list of organisations there that potentially can tap into the solution. So we are talking to BMI Healthcare and Ramsay Health, who are both private providers. I'm just about to do a pilot to test BMI's EDT hub relay with one of our GM hubs. So we're going to pilot over a month that proof of concept for them of bouncing documents into Manchester from their hub. And so we're basically sort of allowing the scope of the organisations to sort of include a wider number of parties external to the NHS core organisations in GM. The idea is that we connect all of this up by hub-to-hub relay, which we've intimated and talked about this morning as far as what the technology allows us to do from Docman and Docman Hub, so that any patient can present at any one of these providers and the discharge or outpatient letter or whatever it is can be delivered back to that GP practice within a 24-hour period. Since August last year, we've sent over 1 million letters through this solution. I can probably comfortably say as well that a large proportion of that will have been without paper. It will have been delivered within 24 hours, and fundamentally it will have made a difference to whatever decision the clinicians will have made as far as speed of delivery and having that information at the fingertips when those patients are presented. The next step for me is to operationalise hub-to-hub sharing. Okay, so the 3 providers that we're going to take forward initially are Royal Bolton Hospital, Salford Royal and Pennine. So obviously once we enable these hub-to-hub sharing links, documents from Salford will be able to be bounced into Bolton or into Pennine and delivered to Bury, Bolton practice, and seamlessly the other way as well. So when Royal Bolton output their documents for Salford, they will flow between the hubs. And that's where the GPs, certainly the commissioners, are really sort of chomping at the bit to have this switched on. Benefits-wise, we've sent over 1 million documents. There's over 390 sites live, okay? And out of the entire 14 organisations, 8 out of 10 have managed to control paper or remove it entirely. There's significant postal savings for providers based on the figures that I showed earlier. Similarly, providers aren't getting fined the same. That over the contractual levers aren't being pulled. Some of the CCGs are, with the providers that are dragging the heels. Ultimately, what's important is that it improves the data that's available to GPs when they consult with the patients and that decision-making process. And I think what we're doing in Manchester is fundamentally contributing to that and improving that.